You wake up in the middle of the night and your mouth feels almost sealed shut. Your tongue is stuck to the roof of your mouth. Your lips feel cracked. You reach for water, but a few minutes later, the dryness returns. Most people blame dehydration and forget about it by breakfast. But before you do that, ask yourself 3 questions. Do you also wake up several times during the night to urinate? Does anyone tell you that you snore, choke, or suddenly gasp while sleeping? And are you taking several medications, especially for blood pressure, allergies, sleep, depression, or bladder control? Because each of those patterns points toward a completely different cause. One may be sitting inside your medicine cabinet. Another may be interrupting your breathing while you sleep without you realizing it. And another may be connected to blood sugar that has been rising quietly for months. Now, dry mouth by itself usually does not mean something dangerous is happening, but when it appears every morning, or arrives with certain other symptoms, it stops being something you should automatically ignore. In this video, I'll show you how to separate an ordinary dry mouth from the patterns that deserve a closer look, and pay especially close attention to the medication warning, because after the age of 60, it may be the most overlooked cause of all. Why your mouth becomes dry at night. First, let's clear up something important. Waking up with a slightly dry mouth occasionally is normal. Your body naturally produces less saliva while you sleep. That means your mouth has less moisture moving through it during the night than it does during the day. But saliva is not simply water. It helps wash food particles and bacteria away. It protects your teeth, supports swallowing, helps you taste food, and neutralizes acids that can damage tooth enamel. When your mouth remains dry night after night, or begins feeling dry during the day as well, that protective system is no longer working as effectively as it should. The real question then is not whether your mouth has ever felt dry. The question is whether the dryness keeps returning, how severe it feels, and what other symptoms are appearing beside it. Those additional clues are what reveal the most likely cause. Cause number 1, you are breathing through your mouth. The most common explanation may also be the simplest. Your mouth is falling open while you sleep. If your nose is blocked by allergies, a cold, chronic congestion, nasal anatomy, or irritation, your body may automatically switch to breathing through your mouth. Air then moves across your tongue, gums, and the inside of your cheeks for several hours. By morning, much of that moisture has evaporated. You may notice that your dryness is worse on nights when your nose feels blocked. You might also wake with a sore throat, cracked lips, bad breath, or saliva that feels unusually thick and sticky. Your sleeping position may contribute as well. Some people are more likely to let their jaw fall open while lying flat on their back. Dry bedroom air can make the problem even worse. Heating systems during winter and air conditioning during summer can reduce the moisture in the room. Even if your body is producing a normal amount of saliva, that dry air may cause the moisture in your mouth to disappear more quickly. This is why some people notice that their symptoms improve when the season changes, when they sleep in a different room, or when they begin using a humidifier. But here is the important distinction. If the dryness disappears soon after drinking water and does not bother you during the day, mouth breathing or dry air is a strong possibility. If it continues for hours, happens every day, or comes with other symptoms, you need to look further. Cause number 2, your medications may be reducing saliva. Now we come to the cause. Many adults over 60 never think to investigate. Your medication may be drying out your mouth. A large number of commonly used medicines can reduce saliva production or make your mouth feel dry. Some blood pressure medicines may contribute, so can certain antidepressants, antihistamines, bladder control medications, muscle relaxants, pain medicines, sleep aids, and treatments used for several neurological conditions. But the biggest problem is not always one medication. It can be the combination. Many older adults take several prescriptions at the same time. One for blood pressure, another for sleep, another for allergies, and perhaps another for pain or bladder symptoms. Each medication may have only a small drying effect by itself, but those effects can add together. That is why someone may begin experiencing severe morning dryness even though they have taken one of those medications for years. A new medicine may have been added, a dosage may have changed, or the combined effect may have finally become noticeable. Here is a useful clue. Think back to when the dryness began. Did it appear soon after you started a new prescription? Did it become worse after your doctor increased the dose? Did it begin when you added an over-the-counter allergy pill, nighttime sleep aid, or pain reliever? That timing does not prove the medication is responsible, but it gives your doctor or pharmacist something valuable to investigate. And this warning is essential. Never stop a prescribed medication or change its dosage on your own. The medicine may be protecting your heart, controlling your blood pressure, or treating another serious condition. Instead, bring a complete list of everything you take, including over-the-counter medicines, to your doctor or pharmacist. Ask whether any of them could be contributing to your dry mouth and whether the timing, dose, or treatment plan should be reviewed. Dry foods may feel hard to chew and swallow. Dentures may become uncomfortable because there is less moisture helping them move smoothly against the gums. Even speaking for long periods can become tiring when the tongue and other tissues are not properly lubricated. Dry mouth is not simply an inconvenience, and although it becomes more common in older adults, often because of medications and health conditions, it should not automatically be dismissed as a normal part of aging. What you can do starting here tonight. Now let's focus on practical steps. First, drink fluid steadily during the day rather than waiting until bedtime to consume a large amount at once. However, follow any fluid limits given to you by your healthcare team. People with certain heart or kidney conditions may be instructed to restrict how much they drink. Keep water near your bed so you can take small sips if you wake during the night. Next, look at the air in your bedroom. If heating or air conditioning makes the room feel unusually dry, a clean humidifier may help add moisture back into the air. Be sure to clean it regularly according to the manufacturer's directions, because a dirty humidifier can collect mold or bacteria. If your nose is blocked, consider discussing chronic congestion or allergies with your healthcare provider. A saline nasal spray or rinse may help some people, but persistent congestion deserves proper evaluation rather than endless self-treatment. You can also experiment with sleeping on your side rather than flat on your back. This may reduce snoring or mouth opening in some people, although it will not solve every cause of nighttime mouth breathing. During the day, sugar-free gum or sugar-free lozenges may stimulate saliva production. Products containing xylitol can be useful for some people, provided they are safe for you to chew or suck without choking. Avoid tobacco, which can irritate and dry the mouth. Alcohol may also worsen dryness, especially when consumed near bedtime. Some people find that caffeine makes their mouth feel drier. So notice whether reducing evening coffee or tea improves your symptoms. Check your mouthwash as well. Products containing alcohol can worsen dryness in some people. An alcohol-free rinse or a product made specifically for dry mouth may be more comfortable. Over-the-counter dry mouth sprays, gels, rinses, and saliva substitutes can provide temporary relief, particularly at night. Continue brushing with fluoride toothpaste and speak with your dentist about whether you need additional fluoride protection or more frequent dental monitoring. And once again, review your medications with a doctor or pharmacist rather than adjusting them yourself. When you should contact a healthcare professional, here is the simplest way to decide whether the dryness deserves medical attention. Contact your doctor or dentist if the problem happens repeatedly, continues during the day, interferes with eating or swallowing, or does not improve after addressing obvious causes such as dry air and congestion. Ask about blood sugar testing if the dryness appears with excessive thirst, frequent urination, fatigue, or blurred vision. Ask about sleep apnea if it appears with loud snoring, gasping, witness pauses in breathing, morning headaches, or severe daytime sleepiness. Mention Sjogren's or another underlying condition if both your eyes and mouth remain persistently dry. Request a medication review if you take several prescriptions or notice the problem after starting or changing a medicine. And arrange an examination if you develop white patches, unexplained mouth sores, significant pain, difficulty swallowing, or rapidly worsening symptoms. Your eyes may feel gritty, irritated, burning, or as though sand is trapped beneath the eyelids. This combination can occur in Sjogren's disease, an autoimmune condition in which the immune system affects glands responsible for producing moisture. The main symptoms often include persistent dry mouth and dry eyes. Some people also experience significant fatigue, joint discomfort, muscle pain, or dryness in other parts of the body. Sjogren's is not the first explanation to assume. Medications, mouth breathing, dry air, and other causes are far more common. But if both your eyes and mouth remain persistently dry, especially when the symptoms continue throughout the day, it deserves a conversation with your healthcare provider. Diagnosing Sjogren's is not based on one quick test. Your doctor may review your symptoms and medical history, conduct an examination, order blood tests, evaluate tear or saliva production, or refer you to specialists for additional testing. The important point is not to diagnose yourself. It is to recognize that persistent dryness in both the eyes and mouth forms a different pattern from simply sleeping with your mouth open. Why chronic dry mouth should not be ignored. At this point, you may be thinking, if the dryness is not bothering me that much, why do anything about it? Because saliva protects your mouth in ways you may not notice until problems begin. Without enough saliva, bacteria and food particles are not washed away as efficiently. Acids remain in contact with the teeth for longer periods. The risk of tooth decay can rise, including cavities near the gum line and exposed roots. Your gums may become irritated. Your breath may worsen. Your lips may crack, and sores may develop inside your mouth. Some people develop oral thrush, a fungal infection that can cause white patches, soreness, or a burning sensation. Eating can also become more difficult. Your sleep provider can help identify the cause and determine whether adjustments are needed. Cause number 4, your blood sugar may be too high. The next pattern is the one you should not casually explain away as normal aging. Dry mouth together with intense thirst and frequent urination can occur when blood sugar is too high. Here is why. When excess glucose builds up in the blood, the kidneys attempt to remove some of it through urine. That process can cause the body to lose more fluid. You may begin urinating more frequently, including during the night. As more water leaves your body, you feel increasingly thirsty, and your mouth may remain dry, even after drinking. But the key is not the dry mouth alone. It is the cluster of symptoms surrounding it. Pay attention if your dryness appears with thirst that seems unusually strong or difficult to satisfy, more frequent urination, especially during the night, unusual fatigue, blurred vision, unexplained weight loss, recurring infections, or cuts and sores that seem slower to heal than usual. Type 2 diabetes symptoms can develop gradually. Some people have such mild symptoms that they do not recognize anything is wrong. They may blame the fatigue on age, the nighttime urination on drinking too much water, and the blurry vision on needing new glasses. Each symptom receives a separate explanation, so the full pattern remains hidden. Again, a dry mouth by itself does not mean you have diabetes. Most people who wake with a dry mouth will not discover that diabetes is the cause. But if persistent dryness comes with excessive thirst and frequent urination, asking for a blood sugar test is a sensible next step. There is no benefit in panicking. There is also no benefit in ignoring a clear pattern that can be checked through proper medical testing. Cause number 5. Your eyes are dry too. Now we come to a less common cause, but one with a very recognizable pattern. Your mouth is not the only place that feels dry. Sometimes an adjustment is possible. Sometimes another medicine can be considered, and sometimes the best approach is simply treating the dryness while continuing the medication. But that decision belongs to a qualified healthcare professional. Cause number 3. Your breathing may be interrupted during sleep. Now consider what happens if your dry mouth comes with loud snoring. This pattern deserves attention because morning dry mouth can occur in people with obstructive sleep apnea. During obstructive sleep apnea, the airway becomes repeatedly narrowed or blocked while a person sleeps. The person may snore heavily, breathe through the mouth, become silent for several seconds, and then gasp or choke as breathing starts again. The disturbing part is that many people do not remember any of it. They may believe they slept for 7 or 8 hours, but their sleep was interrupted again and again throughout the night. Sometimes the first person to notice is a spouse or family member. The combination to watch for includes morning dry mouth, loud or irregular snoring, gasping, choking, or pauses in breathing, morning headaches, difficulty concentrating, and severe daytime sleepiness even after spending enough hours in bed. Dry mouth alone does not diagnose sleep apnea, and not everyone who snores has the condition. But when loud snoring, gasping, daytime exhaustion, and morning dryness appear together, it is worth discussing with your healthcare provider. Untreated sleep apnea can affect more than your sleep. It may place additional strain on your cardiovascular system and contribute to other health problems. The condition can be evaluated through sleep testing and treated once it is identified. And if you already use a CPAP machine but continue waking with a dry mouth, do not assume the treatment is failing. Dryness can sometimes be related to mask fit, mouth breathing, congestion, humidification, or the machine's settings. Conclusion. So what does waking up with a dry mouth actually mean? Sometimes it means your bedroom air is dry. Sometimes your nose is blocked and you are breathing through your mouth. Sometimes a medication is quietly reducing your saliva. And sometimes, especially when other symptoms appear, it may be connected to sleep apnea, high blood sugar, or an autoimmune condition that deserves investigation. The dryness itself does not give you the complete answer. The pattern does. Does it disappear quickly or last all day? Did it begin after a medication change? Do you snore and wake exhausted? Are you constantly thirsty and urinating more often? Are your eyes dry as well? Those are the questions that turn a vague symptom into useful information. You do not need to become frightened every time you reach for water in the morning. But you should not ignore persistent dryness simply because it seems minor. Pay attention to what appears alongside it. Protect your teeth and mouth, and discuss recurring symptoms with your doctor, dentist, or pharmacist. A dry mouth may be easy to overlook, but the clues surrounding it can tell you when a simple nighttime adjustment is enough and when your health deserves a closer look. If this video helped you understand what your body may be telling you, subscribe to Care After 60 for clear, practical guidance on the health signals that become more important with age. Take care of yourself, and I'll see you in the next video.